Good afternoon. I'm sorry to keep you guys waiting. Like I said, I'm sure that people don't often want to grow up and be health insurance experts. I certainly did not want to, but um, I have two kids with other, they would be upset if they heard me say kids. They're 35 and 30 now. Um, I have two sons that have severe hemophilia. And so I was working in the legal field when my oldest was born, and he, we did not know that we had no family history of hemophilia, and we found out he was diagnosed because he had an intracranial hemorrhage when he was 3 days old, and so I had to learn really quick about how insurance works. So, um, and I've just told you how old they are. So I have 35 years experience of working with insurance companies and health plans and working with patient advocacy groups. So hopefully I can share some things to make insurance a little less frightening and difficult for everyone. So um, before I get started, like I said, I have worked in the patient advocacy space for about 35 years, primarily in bleeding disorders. But I have partnered with other national groups over the years. I worked with, first, I ran my local chapter for the Hemophilia Foundation in Indiana for a while. And then, right before health reform began, I went to the National Hemophilia Foundation. And I worked for them for 12 and a half years, overseeing their state and federal policy initiatives. And I had a CEO who was very forward thinking. And I said, you know, we're now going to be able to get insurance, without having to go through Medicaid or Medicare. But none of us know how to pick an insurance plan because, I mean, if you have a chronic disease, you kind of take whatever you're given and you're excited you have some coverage. And I said, now we have to make choices. And so he gave me the freedom to, really start working with health insurers, trying to educate them about hemophilia and chronic disease in general, but specifically about hemophilia and what to expect when they started to get some of us in their health plans that they'd never had before. And so I started by, having webinars to educate them about what was the standard of care for, people with hemophilia, who was affected, how many patients there were, kind of what the treatment was. And then in about 4 years in about 2014, I created a program called the Comprehensive Care Sustainability Collaborative. And what it was I brought together payers. And by that, I mean, whether it was a self-insured employer, whether it was a hospital system, whether it was a Medicaid program or a commercial health insurance company. I brought them into a room and I brought our clinicians into a room. And we said, I said, well, what we're going to do today is we're going to learn about each other. What is it that, guides us in making the decisions we make? How does, the health plan, what is it that they have to consider when they're thinking about how they design their coverage? What are the things that keep them up at night? What are the questions that keep them up at night? And for the clinicians, I want you guys to explain how you're treating this condition, how you see changes coming, all those sorts of things. I can tell you that program is still going on at the national organization. I left in 2021 and decided to start my own consulting business in 2022 because I really feel like access to care for those of us with chronic, expensive conditions, rare conditions, is really at the greatest risk it's been at in many, many years. And it's really because of all the great innovation that's out there. It's all of the new drugs that are coming out, and everything's expensive. So who's going to pay for all of it? And now health plans have to cover everyone. So how, There was a lot of great things that happened in health reform, mainly that those of us with rare chronic conditions could not be denied any more coverage. We could go and choose a health plan. We didn't have to worry about lifetime limits. My son capped out on our insurance when he was 4 years old. So, there's lots of challenges that, that took care of. It brought access to a lot of us, but what it didn't do is address all of the cost concerns that there are in healthcare. And so I wanted to be able to really help patients across a broader spectrum of conditions. And specifically, my focus was rare disease. And I wanted to be able to help folks understand how to make decisions about what plan you're going to choose, how to know what's available for you, whether, a lot of people may have insurance through their employer and don't realize that they can also still have Medicaid. Or they may have Medicare and not realize they could still have Medicaid. Or there may be other assistance programs, one which we just found out about while I was talking to somebody out here as I started to look around, and we found something that was available for her that we didn't know about. So I wanted to be able to make sure that people really understood what they were getting into when they choose a health plan. And thankfully, I went to the National Organization for Rare Disorders and I said, one of the biggest problems I have seen over the last several years of working with, all these different stakeholders is that a lot of people really don't understand how health insurance is supposed to work. They don't understand some of the terms. I know there's plenty of times I go in to see my doctor and they're describing stuff, and I've now been in the space for 35 years and I'm still like, what is that? What are you referring to there? So I wanted to make sure that we could help improve people's health coverage literacy so that you know what the terms are that are being used, you know what the acronyms mean. You look at an insurance plan. How many of you have ever read your insurance plan? Right? Okay, well, a few of you have. You think about it when you go out, I think this should be taught in schools. I really do think this and how to do your taxes should be taught in school, and it's usually not. But I know when I went and got my first real job, as my mom would call it, I was like, how much are you going to pay me? How much vacation time do I get? Oh, I get insurance? Okay, check. I didn't really look. I was young, healthy, didn't expect to have any problems. No one plans to get sick, but unfortunately, it happens to all of us at some point. So it's really good for us to be prepared and know what we need. So I had went to NORD and said, I would like to create a, health coverage literacy program that breaks down into really easy to understand language. What are the basics of healthcare that apply to any kind of health insurance coverage? What are the different kinds of health coverage options that are out there? And then one of the most important things is if you're on a health plan and you need a service or a therapy and you get denied, how do you appeal that denial? Because I'll talk about that in a little bit. And luckily, they agreed to work with me on this, and we were able to get some sponsors. And we created a program called NORD Claim Your Care. We just launched a website in March. It's at claimyourcare.org. It's open to anyone. We are continuing to add to it different resources and materials, but that's what I really want to talk to you about today. This is a great resource for you to reach out to when you have questions. So kind of why did we decide this was needed? There's been several studies done over the last several years since the ACA came out saying, trying to understand how well do people understand their insurance. Part of this comes from someone could have a great healthcare, health insurance plan, and basically it covers everything they need, but we're still seeing that patient isn't accessing all those services. and they're having complications of their disease or complications of their condition because they're not treating it. And what we found a lot of times is they weren't treating it because they didn't realize they had coverage for it. They were worried about the cost if they went to the hospital or somewhere else. Well, now I'm going to have this extra cost that I can't afford because it's hard enough to pay for all my medicines or all the other care that I need. And so again, it says 1/2 of US adults rated themselves as having inadequate health insurance literacy, meaning we just don't understand our insurance plan. And of those, almost half reported, having low confidence in using their health plan because, again, they weren't really sure what it covered. Now, many of you may have received, I know that I worked with Nancy and Eva to put together a very short survey that we sent out to folks before this meeting, trying to understand how folks are covered. And we asked some of these questions. And I will tell you, one of the questions was, how comfortable are you with using your health plan? And again, it almost met this. 50% of the respondents said, I feel pretty comfortable. Some were like, I feel somewhat comfortable. No one felt fully comfortable with navigating their insurance plan or understanding what was covered. And then the question was, how sure are you of what the benefits are? And again, it was about 50-50. A lot of people said, I don't understand what the benefits are. That's one of the most difficult things I have to deal with my insurance plan. So just wanted to let you know, if you get frustrated with that stuff, you're in there with 50% of the other folks in the US are having those same issues and those same concerns. So, why do we think raising healthcare literacy is so important? Is because it can help improve communication between you and your provider. I mean, how many times have you been in talking to your provider? And I would follow my kid's provider to the end of the earth. She has saved my kids' lives on more than one occasion. She and I can fight like brother or like sisters can, but at the same time, I would grin and bear it if my kids needed something, and I would follow her wherever she went and do whatever she said. But there's plenty of times that I come at this condition when I'm in there talking to my doctor with, what am I seeing? What is my lived experience? What am I seeing my kids experience? She's coming back and talking to me from her perspective as a provider as to what we believe is best for you is this. I'm like, okay, but are you hearing what I'm saying I'm seeing? Because it doesn't seem like those two things go together, right? So again, it just helps it helps the communication between you and your physician. And the biggest thing is it helps you understand the breadth of the coverage options you have. Again, I just said, we were just talking to someone out in the hallway and realized that they were eligible for a whole lot more if they made this one change. And it wasn't like she wasn't trying to find that information. She knew where to go. She was asking the questions. They weren't giving her the answers. And sometimes we just need someone to give us permission. So I said to her, I said, great, just hang out with the person, go say, thank you for your help today. Hang up, wait 15 minutes, call back, and you're getting somebody else. And you're going to write down the name of everybody you talked to. You're going to write down the date, and you're going to write down what they tell you. And we certainly found out, she said, I feel like they're just not giving me everything I'm supposed to be getting. It wasn't even close to what she's supposed to be getting. So I can't wait to hear from her a month from now or see her name in the paper because she's like blown the place up on teaching them what they actually cover. And I will tell you this, it is very interesting. There are times that I am on the phone with an insurance, whether it's my insurance plan, whether it's my son's insurance through our state Medicaid program, where they will be telling me that there is a service that is not covered. And I will say, yes, it is. And they'll say, no, we've never covered that service. I'll say, are you sitting at your desk Yes. Go to your website. Click here. Now go here. I go scroll down halfway through the page. You see where it says this? They're like, yes. And I'm like, now read that sentence underneath there. And they're like, oh, I wonder when we started doing this. And I said, my son's been on your plan for 10 years. He's always had access to that until for some reason this year when you said he didn't. So sometimes we have to educate them. And I don't want to point fingers at people and say they're, not trying, because I do believe I worked with a lot of health plans over the last 10 years, 11 years. And I really do believe that in the heart of hearts, they really want to do what's right for the patient. But think about it. How hard is it for you to remember everything about what's going on with your kid's health condition? Now imagine having to do that for all the conditions that are out there. It's a lot for them to remember all that. So sometimes we have to help them get to where we're at. We may know, we may need confirmation, but it's up to us to kind of learn a little bit more about our policy so that when they forget or when they're not sure where to look, we can remind them. And so that to me is one of the biggest takeaways from this is the better you understand your health plan, I guarantee you the more services you're actually going to find you have, and you won't have to go through some of the difficulty in trying to get them in the first place, right? And then, I said something about the importance of understanding how to appeal a denial. Many of us, we get denials, and for some of us, we're lucky. Let's say they deny a medication, and maybe, in hemophilia, we have, thankfully now, we used to have like 5 different therapies that could be used. We now have about 25 different therapies. So if one gets denied, I know I'm still going to get something to treat with that day. I may still want to go back and argue for what I wanted originally, but I know I'm at least going to get my medication. In some rare conditions, there may not be another alternative, right? Or there may be, maybe there is another alternative that we already know isn't going to work for you, right? Very interesting stat came out recently that 850 million claims are denied a year. And what I'm going to tell you is we always see in the paper how, all these insurance companies have these policies where they just deny automatically the first time something comes in. Does that happen with some health plans? Probably. Is that really the norm? No. There's a lot of reasons why those denials end up happening. But what's very interesting is that only 1% of those get appealed. I get it. If you're dealing with chronic health conditions, sometimes you are so overwhelmed. It's like, if I have to fight one more fight, I just don't have it in me. But let me tell you, it's worth it. Once you do it once, you're going to know how to do it if it ever happens to you again. So it's that first one you have to get over the hurdle, but only 1% of those 850 million are appealed, yet 75% of them get overturned. So just think about it. It's worth taking the time to do that. The biggest problem is knowing what are the timelines, what is it I need to do. Now, whatever kind of health plan you're on, if it's Medicaid, if it's, commercial insurance, and if they deny something, a service or a therapy you've requested, they have to send you something that tells you why they denied it and how to file an appeal. Now, some of those letters that come out are very easy to follow, have really good instructions. Not everybody's great at doing that. OneClaimYourCare.org. If you go into the program, and I'm going to slide forward to it here in a second and show you where to go. But if you go to the health coverage options tab, it will tell you, here are all the different kind of healthcare options out there. Here's commercial insurance, employer-sponsored insurance. Here is Medicaid, Medicare, TRICARE, veterans. And we provide an overview of each one of those. And then we also have there how to file an appeal. And it gives you step-by-step instructions. It tells you what the timeframes are. I will tell you that you always have a much better chance of getting your appeal approved if you are working with your doctor to make sure that you have all of the pertinent information to attach to your appeal. Sometimes the doctor will file it for you, but I really think it's good for you to be working together to get those in. I think you have a better chance typically of getting those approved. What I didn't mention is that after my son capped out on his insurance, I was fortunate that we lived in a state that had a very good high risk pool. And so my kids both ended up being transferred to the high risk pool. And I was fortunate enough again to be asked to serve on the board of that insurance program. And so this is where I learned a lot of the processes and how it works. And I sat on the appeals and grievance process. And I would say for us, it was probably higher than 75% that got overturned. It was probably 90% of those we would overturn. And I will tell you, in the majority of cases, the reason it was denied in the first place is the appeal came in, or the prior authorization request came in the first place without having all of the necessary information that we needed to be able to say yes. So just so you know, again, key point to walk away with: if you get a denial, appeal it. And there are places other than your provider's office who can help you, but your provider is the one you need to get the medical support from to go with that appeal. So what I can say is, where can you go to get this? This is kind of weird, by the way. It doesn't look like all my slides transferred up here. There's some slides missing, which is kind of weird. But like I said, I've been living and breathing this stuff for 35 years, so I think I can tell you what was on those. Where do you go to get access? Like I said, it's all online. There are right now just a couple of different tabs. You'll see there's the health coverage basics. You'll see there's the health coverage options. Underneath the health coverage basics is where you're going to get some general information on types of things that apply broadly to most, if not all, health plans. So for example, what's your summary of benefits look like? And this is important when you're choosing a health plan, to always look at the summary of benefits for each plan that you're looking at. The Affordable Care Act did lay out that all qualified health plans need to use the same format for their summary of benefits, which is great because now you can compare apples to apples when you're looking at different options. And this is where it will tell you what all is covered under your plan, what's excluded. For those things that are covered, it will tell you what your cost share is for that, if it's required. It will tell you if you have any out-of-network benefits. How many of you are familiar with out-of-network benefits, right? How many of you get your insurance through an employer, whether it's your health plan? Okay, I was gonna say about 50% of the people on the survey responded that they got it through their employer. The reason why I ask is, in the marketplace, and actually now in a lot of employer plans too, most employers will offer you more than one option, right? They may call it a low option or a high option or a PPO or an HMO or something along those lines. Basically, the one difference you're going to see in those, no matter what, is that high plan will usually include some out-of-network benefits. Meaning, if my specialist is not in network, I can still go see who I want to. I may have to pay a little bit more. I may have to pay a little bit higher copay, but I can go outside. In the marketplace, most marketplace plans are what we would consider kind of an HMO model, or a health maintenance organization model, which means you have no out-of-network benefits. You have to stay within that network, or that service that you get out of network will not be covered unless by some miracle you were able to get an exception. And typically you would need to do that up front. And so the thing about not having out-of-network benefits is, I say you have no out-of-network benefits. The one exception is if there's an emergency, right? Now, let me preface that by saying, I know what I consider an emergency. And unfortunately, they don't look at what my thought was on an emergency. They have their own opinion of what an emergency was, right? And it's funny because I've read in some health plans what it'll say, you do have, if you need to see an out-of-network provider due to an emergency, and then I'll say, comma, loss of life or limb. Personally, I can think of a lot of other things besides that I would consider emergencies, but I'm just letting you know, they have a very strict definition usually of what is considered an emergency. So, again, I'm pointing that out to say that your summary of benefits, when you are looking at making a choice of a health plan, it's really important to be looking at the summary of benefits for that plan so that you know what is covered, what isn't covered, because that will affect your pocketbook and your care. So it's really important to do that. But the other things that are in there is like, what is a prior authorization? What is surprise billing? It has we have some basic, what I call them navigation guides, but fact sheets that kind of walk you through some different things like understanding health insurance and how to use it. And I have these, I brought a few of these, and I have them there for anybody that would like to kind of pick some up to take a look at them. And it basically is just kind of giving you some general, tips about what is health insurance supposed to be, what's it supposed to do, how does understanding it help you, and, how can you benefit by being able to better understand it. We also have stuff on continuation of coverage, like COBRA. If you've changed a job or lost a job, how do you make sure you don't get a gap in your coverage? And then we also have some navigation guides on some things that I brought along with me today, because specifically, for those of you who get your insurance to an employer, how many of you know if that is a self-insured plan or a fully insured plan? Some of you know that. And I think it's very difficult to identify because your card can kind of look exactly the same. But just quickly, the difference between those two is a self-insured plan is not governed by state statutes or state rules. It is governed by the federal government under ERISA, and self-insured plans do not always have to offer all of the essential health benefits that were outlined in the Affordable Care Act. So there's things that they don't have to cover that every other plan has to cover. And so that's important to know. And we are seeing, look, health plans are trying to figure out how can we afford to cover everybody? How can we afford to cover everybody, and what can we do to lower our costs? And so there's a lot of what they will call as cost saving strategies, which those of us in the advocacy space call, schemes. What new insurance scheme is being used to reduce, costs? And what that means is they're transferring more costs to you. So I do have a couple of fact sheets there, and my colleague and I, Elizabeth Stoltz, is in the back. She has 30 years of experience working in advocacy in the pharmaceutical industry. She also has worked in the advocacy space within that realm for that time period, and is a great resource, and made the mistake of retiring at the same time that I left, and I convinced her to come back to work. But I have two different are three different documents there, or two different documents. One that talks about something called an accumulator adjustment program, and one that talks about a copay maximizer program. These are things that you need to watch for in your plans because they will affect your out-of-pocket costs. And Elizabeth and I are around to talk about, to answer any questions that you may have after this. The other thing that we have on here is, oh yeah, it skipped every other slide is what it did. I don't know why. The other resources, here you see where it says healthcare options. Again, I'm talking about, private plans versus public plans. Private plans are going to be your health insurance marketplace, your employer-sponsored insurance. Your public options are your Medicaid and your Medicare, your VA program, and kind of and TRICARE coverage. And then for non-insurance programs, there is a program for like the Native Indian population. There's a program for them where they can provide services, but it's not really an insurance plan, but they do provide services to patients that fit into that category. The same with the VA program. It's not really insurance, but it's certain services that they will cover at no charge to the individuals. Again, in that section, we'll also, talk a little bit about, can I have more than one type of coverage? Which coverage would come first? What options do I apply for? All of that you will find in the overview of those programs. And then just quickly, how to learn more. You can go to claimyourcare.org. You can also go to one of these addresses. You can email membership@rarediseases.org if you have questions about the Claim Your Care program specifically. But if you have insurance-specific questions, there is a patient services team. I've given you the phone number for them. Also, it is available. The team is available in Spanish. You can reach out to them there, or you can go through this final link and actually fill out information about what you're looking for assistance for. I will tell you, NORD has some amazing assistance programs available for different disease groups. If you have never gone there and looked, I would encourage you to do that. They also have some other assistance programs. Sometimes they will provide assistance for you to come to a meeting, maybe a meeting like this or a NORD meeting. They will help provide that kind of assistance. And I apologize. I know I had 30 minutes to get that all out there, and so I kind of talked at you. I hate doing that. But I can tell you we're available for questions. We're going to be here all evening. And this is what Elizabeth and I are passionate about, and we want to help you if there's something we can help you with. So thank you.